This is Dr. G and Dr. Soda with another episode of Kidz Chat. Today we're going to be talking about fevers. So Dr. Slaughter, what is a fever?
So a fever technically is any temperature that's 100.4 or higher.
And what is the best way to take a temperature?
There are several ways to take it. The most common way is either under the armpit or in the mouth, or for an infant, you can actually take it rectally.
Now, is rectal safe, and do you think some parents might be scared to take it rectally?
It's very safe. It's very safe, and like I said, it's the most accurate for infants. And I think most parents are comfortable taking it that way. You're not really trying to insert it into the rectum. You're just kind of more so putting it between the little butt cheeks.
Mm-hmm. And a lot of parents, they might be scared of the height of the temperature. For example, you say a temperature is 100.4 and greater.
Exactly.
What if a parent calls you and tells you that it's 105? Does the height of the fever mean that it's more severe?
Not necessarily, though parents absolutely get freaked out from fever. And they think that it means something bad. And obviously it is a sign of infection or inflammation or something that's going on in the body. But fever is actually a good thing when the body has an infection, because the fever is what allows your immune system to kind of kick in to start treating the infection on its own. In terms of the height of the temperature, obviously once we start hitting 104, 105, then we do get a little bit concerned, just because it kind of kicks up your other vital signs. So it'll kick up your heart rate, your respiratory rate, and usually it just makes you feel crummy when it's that high. So, once it starts to reach those levels, then we do get a little bit more concerned.
Now, I'm sure you've gotten calls in the, let's say, 10 o'clock at night, a parent calls you and says, look, my child has a fever, and you ask, so how high was it? They say, well, I don't have a thermometer. They feel hot. What is a parent supposed to do at that point in time?
So again, it depends on how the child is acting.
Okay.
If the child is still kind of running around, playing, acting like their normal self, you really don't have to do anything. You can just kind of let the fever kind of dissipate by itself. But if the child is lethargic, they're laying around, they're not eating and drinking as much, they're not staying hydrated, then for sure you maybe want to give them some fever-reducing medication to see if it helps them.
So I don't need to take my child to the emergency room just because they have a fever?
Not for fever alone. So if they have other symptoms as well as the fever, cough, runny nose, headache, abdominal pain, obviously anything like vomiting, diarrhea, then those are signs that you may want to get it evaluated. But for fever by itself, not necessarily.
So if my child has a fever, I don't necessarily need to take them to the doctor. It's based on other signs and symptoms that the child might have. And so just reiterate to us, what might some of those signs be that I want to take my child, not necessarily to the emergency room, but to my general provider?
So again, just if anything is anything in addition to the fever is not normal. So if your child is normally very active, but now they're kind of sluggish, they're laying on the couch, they're not engaging in their normal activities, then those are signs to reach out to your primary care provider. Again, doesn't mean they need an appointment, but definitely just to kind of run it by somebody else just to make sure.
Right, so I don't necessarily need to take them to the doctor just because they have a fever.
Correct.
But what if the fever has been going on for like 4 or 5 days and they don't exhibit any signs or symptoms?
So then that too, the duration of the fever for sure gets concerning. So I usually say 48 hours. So if you have a fever for 48 hours, again, if it's not spiking those kind of high levels of the 103, 104, 105, the kid is still acting normal, they're still drinking, staying hydrated, then you don't have to take them in to be seen. But once we hit day 3 of fever, especially if there's nothing else going on, then again, I would say it's time for them to get evaluated.
For sure. So duration of the fever matters, other signs and symptoms matter, but the fever in and of itself may not be a
big
sign.
deal. Exactly.
Okay, well, that makes sense.
Exactly.
You mentioned the best places in the body to take a temperature. What are the different types of thermometers?
So the most common thermometer these days is actually a digital thermometer. And you can buy those at any convenience store, drugstore, Target, Walmart. They also now have the temporal thermometers, which a lot of parents are using. They have the ones where you can put it in the ear, just the digital ones for the ear. And of course now, given COVID, they have the contactless thermometers that you can use on the forehead. Something also important to note, though, is that they still have mercury thermometers on the market, and those are actually not recommended anymore because of risk of poisoning.
So I'm sure a lot of parents still have mercury thermometers from back in the day, but
Yes.
they're not recommended.
Absolutely. As a matter of fact, I think I still have one from when my son was an infant. But yes, they're not recommended anymore. If you do have those, you should probably throw it away just because of the risk of poisoning if they get broken and the child gets into it.
That's true. That's true. So are there any age groups that are at a higher risk than others?
Yes, that's a great question. So infants and particularly those that are 2 months of age and younger are at increased risk. Some people would even say 3 months and younger, just because that age group is so susceptible to serious bacterial infections. So anybody who I usually err on the side of caution and say 3 months and younger should absolutely consult their physician if their baby has a fever.
So if I have a 5-year-old and they have a fever and no other signs or symptoms, I can potentially give...
Just kind of watch and wait, like we said earlier.
Right?
Yep.
But if I have a 2-week-old, I call my doctor at night, and what am I going to expect to hear?
So the doctor is most likely going to tell you to go to the emergency room. Again, just because there's such a high concern for serious bacterial infections at that age, they'll probably send the baby to the emergency room where they'll do some lab work. They may check their urine. You know, kind of the most invasive procedure that they may get is a lumbar puncture. But that's just to make sure that the baby doesn't have meningitis.
Right. So it sounds like it can be very serious if an infant has
Absolutely.
a fever compared to an older child.
Yes.
Now, is a fever the same in an infant and a 5-year-old?
It is the same. So 100.4 is our cutoff, from 0 to 100. But like I said, the age of the child is what kind of raises our concern for that fever.
Now, invariably, you will probably get a call in the middle of the night asking, my child has a temperature of 100.3.
Right.
It's a 0.1 difference, right?
It happens. It happens all the time. We even have parents that'll say, oh, my baby has a low-grade temperature of 99. And then, for a medical professional, we usually say, okay, well, that's not really a fever. But it just shows that the parent is becoming aware that their child is acting different or doing something different than they normally do. So you still have to kind of take the whole picture into account. Because even though it may not reach that 100.4 threshold, if the child has a slightly increased temperature but ear pain or sore throat or vomiting and diarrhea, then again, it's not necessarily a hard cutoff for, okay, we only are concerned at 100.4.
Yeah, because it's always something that I always ran into. I always listen to the parent.
Yes.
I have my objective data to say this is potentially a disease process, but even in the absence of a fever or a temperature, a high temperature.
There's other stuff going on,
correct.
Absolutely.
Right. So it's very important to actually listen to the entire story that the parent is trying to paint for you.
To paint, absolutely.
Right?
Yeah, but I always say, mommies know best because your child the best. So if you feel like something is going on different with your child, then absolutely let your medical provider know.
And certainly in the days of COVID, do I need to be more concerned, the same concern?
I would say the same concern. It's going to be that whole constellation of symptoms. So it's not just going to be a fever. Obviously, if your child has been in contact with someone who either has been diagnosed with COVID-19 or has other symptoms of COVID-19, then yes, you're a little bit more aware and alert. But I wouldn't say for the normal everyday child who's been quarantined in isolation that's the first thing that has to come to your mind. Right.
So if my child has a fever, since we brought up COVID-19 and quarantine, do I just take them directly to the doctor's office?
So it depends on your medical facility. I would say I feel like most medical offices these days are telling parents to just kind of stay at home and call first. I think most offices are also doing televisits now. Yes. And so they'll probably screen your child first via televisit. And then depending on what else is going on or their level of concern, they may either bring you into their office or may send the child directly to get testing if they're concerned about that.
So just to summarize, a fever is defined as 100.4 or greater.
Yes.
The importance of the fever along with other signs and symptoms become important.
Yes.
And it's not always the fever. Sometimes you can have other signs like diarrhea and cough without a fever that need to be taken into account. The age of the child, such that an infant of 1 to 2 months of age versus a 5-year-old is taken care of very differently.
Very different.
Right? Is there anything else that we need to take into account?
No, you named all the major things that we usually take into account, but the bottom line is just when in doubt and you feel like your child is not acting normal or healthy, always contact their medical care provider.
Excellent. So this is Dr. G and Dr. Slaughter from Kidz Chat. Any questions, let us know.